Hello, welcome back to my channel. I am Amit Lunkad and today going to discuss on topic alpha glucosidase inhibitors. These alpha glucosidase inhibitors is a class of medications used to manage blood sugar levels in people with type 2 diabetes. In this video, we discuss in detail about mechanism of action, clinical applications, some contraindications of these alpha glucosidase inhibitors. Let's begin with introduction. Alpha glucosidase inhibitors are a class of oral medications used primarily in the management of type 2 diabetes mellitus. They work by slowing down the digestion and absorption of carbohydrates in the small intestine, which helps to control postprandial blood glucose level, that is, rise in blood sugar after meals. These drugs are especially helpful for controlling blood sugar spikes that typically occur after eating. These inhibitors advantageous for individuals at higher risk of hypoglycemia or lactic acidosis. These are given alone or combined with other antidiabetic drugs. So these are the few important points regarding alpha glucosidase inhibitors. Now here we discuss mechanism of action. Normally, this alpha glucosidase is an enzyme found in the lining of the small intestine. It breaks down complex carbohydrates such as starch and disaccharides like sucrose and maltose into simpler sugar like glucose and that further absorb into the bloodstream. But these alpha glucosidase inhibitors block or inhibit the action of these enzymes and thereby slowing the digestion of carbohydrates. As a result, glucose is absorbed more slowly and leading to a lower and more gradual rise in blood glucose levels after meals. And therefore, we can solve the problem of increase in blood sugar level after eating. So this is the mechanism of action of alpha glucosidase inhibitors. Now about the few drugs which can be used like acarabose, which is commonly prescribed alpha glucosidase inhibitors. This acarabose has been shown to reduce postprandial blood glucose levels and HbA1c, which is a marker for long-term glucose control, but may cause more GI distress than other oral diabetic agent. Second drug is tilmiglitol. This miglitol often prescribed for people who experience intolerance GI side effects with other agents. And last one is the voglibose, which is used in some Asian countries like Japan and India, and it's less commonly available in the US. Now about clinical uses of alpha glucosidase inhibitors. Firstly, obvious it can be used for postprandial hyperglycemia. Means these drugs are more effective in managing postprandial means after meal blood glucose levels. Since they slow the digestion of carbohydrates, they help to prevent sharp spike in blood sugar that typically occurs after eating. It is also clinically used in type 2 diabetes mellitus. Alpha glucosidase inhibitors are generally used in people with type 2 diabetes who cannot control their blood sugar with lifestyle changes alone or in combination with other oral medications like metformin or sulfonylureas. It can be clinically used in combination therapy. They are often used in combination with other antidiabetic medications such as metformin or insulin to help to improve overall blood glucose control. Now about some side effects. Firstly, it can be produce gastrointestinal disturbances. Since alpha glucosidase inhibitors slow down the digestion of carbohydrates, undigested carbohydrates reach the colon, whereby they are fermented by bacteria. And this fermentation process leads to gas production, causing symptoms such as flatulence, bloating, diarrhea, abdominal pain. And because of these side effects, this is the reason why patients stop taking the medication. However, they tend to decrease over time as the body adjusts to the medication. Second side effect is hypoglycemia. Although alpha glucosidase inhibitors do not directly cause hypoglycemia, when used in combination with other antidiabetic medications, hypoglycemia can still occur. In the event of hypoglycemia, it's important to treat with glucose rather than sucrose, as alpha glucosidase inhibitors inhibit the sucrose digestion. And one more side effect is elevated liver enzyme. In rare cases, alpha glucosidase inhibitors may cause mild increase in liver enzyme, so liver function should be monitored periodically. And one more thing, need to monitor the blood glucose time to time. Now about the contraindication. The alpha glucosidase inhibitors are contraindicated in intestinal conditions. People with intestinal obstruction, inflammatory bowel diseases, or other conditions that affect the normal function of the intestine. So it is contraindicated in this intestinal condition. Second, it is contraindicated in severe renal impairment since these medications are excreted through the kidneys and they may lead to and they may need to be adjusted or avoided in patients with severe renal impairment and in pregnancy and lactation. Alpha glucosidase inhibitors are typically not recommended during pregnancy or lactation as safety data in these populations are limited. So here we discuss in detail about mechanism of action, contraindication and clinical usefulness of alpha glucosidase inhibitors. Hope all of you are getting this. Thank you. Happy learning.